In this video, let us discuss about toxicology. Toxicology is the study of poisons, properties, actions, detection, treatment of the poison. Study is known as toxicology. Now, what is a poison? Poison is any substance when inhaled, ingested, applied, or administered in the body produces ill health or death. This video is the first part of the series of toxicology videos that I will be keeping in YouTube. In this video, we'll learn about general considerations, agricultural poisons, corrosive poisons. General considerations. First, we will learn about the causes which modify the action of poisons. First thing, which is the main cause that modify the action of poisons, are quantity, form, mode of administration, condition of body. There are four main causes, and let us see how the quantity of the drug or a substance which modify the action of poison. Small doses. When a drug or a poison or a X substance, when taken in small doses, it causes therapeutic action. And if the same drug, when taken in moderate doses, it causes irritant symptoms. And when the same drug, if taken in very large dose, it causes shock without causing irritant symptoms. And if the same drug, when taken in large dose orally, it get rapidly eliminated and it have no toxicity. So when someone wants to die and they ask you for help, tell them take the drug in very large dose so that they will get shock and without experiencing irritant symptoms they can die. Form. How the form of the drug or any poison will affect the action of poison. Let us first discuss about physical state. We all know that poison can be gaseous, liquid, and also in solid form. The rapidity of the gas is more than liquid, and the rapidness of solids depends on their solubility. When I speak about solubility, certain poisons which are not soluble in water may become dissolved in the acid secretion of stomach and absorbed into blood. So certain poisons which are not harmful when we eat them, but they are harmful when they enter in our stomach and they causes toxicity after they absorbed into blood. Examples include lead carbonate, copper arsenate. So what do I meant by rapidity? As I said, rapidity of gas is more than liquid. For example, I inhaled a poisonous gas. I may die within 2 minutes after inhaling that poison. But if I drink the same poison, I may die in 4 minutes. That means my body shows more response, and if it is in gaseous form than it is in liquid form. That is what I want to explain in physical state. So the summary is the rapidity is more in gaseous than in liquid, and the rapidness of solids depends on the solubility of the poison. And chemical combination. The action of poison depends upon the solubility or insolubility resulting from a chemical combination. For example, silver nitrate when mixed with hydrogen chloride. So first of all, silver nitrate is a strong poison, hydrogen chloride is also a strong poison. When they are both mixed, it produces a chemical component called silver chloride, which is insoluble and harmless salt. So what do we understand by this? When two strong poisons when are mixed, it produces a insoluble harmless salt. That what we understand. And another example is a substance may be harmless in metallic state, but its salt may be toxic. Example, arsenic is not poisonous, but its salts are poisonous. That those things are seen in this chemical combination that we have to know. And what do we mean by mechanical combination? The action of poison may be altered if combined mechanically with inert substances. Example, small dose of concentrated mineral acid produces corrosive action, but the same dose largely diluted with water is harmless. And mode of administration. Let us explain this mode of administration with an example. If the active dose by the mouth is considered as a unit, the rectal dose is 1.5 to 2, and the hypodermic dose is about 1/4. A lethal dose is usually 10 or more times the maximum medicinal dose. Condition of body. Age. How age affects mode of action of poison. Poison have greater effect at the two extremes of age. When infants and the old age persons took the poison, there are higher chances that could eliminate them. But middle-aged and adults, when they took the poison, it causes less effect on them. Idiosyncrasy. What is meant by idiosyncrasies? Certain people are sensitive for certain drugs and even articles of diet. So this explains that some people are allergic to peanut, and those people can die just simply by eating a peanut. Example, shellfish, eggs, fruits, iodine, bromine, opium, heroin, cocaine, penicillin, and aspirin also. These are the common examples that most people are allergic to. Habit. The effect of certain persons decrease with habituation such as opium, alcohol, tobacco, etc. That means if a person daily takes alcohol, daily takes opium or tobacco, the effect of alcohol or opium to that person is very low. He will not have irritation at all. But a person who is not habituated to taking alcohol, opium, or tobacco, it will cause symptoms such as headache, dizziness to that person. Ataxia is commonly seen if a non-alcoholic person takes alcohol. State of health. How state of health affects the mode of action of poison. State of health. A healthy person tolerates better than a diseased. Ordinary person, ordinary safe dose can cause death in a person suffering from a chronic disease. A ordinary safe dose can cause death of a person suffering from chronic disease, which means if there are two persons A and B, A is suffering from chronic disease such as diabetes and B is a healthy person, a drug which is a ordinary dose such as 250 mg of the drug when given in a healthy person, it does not cause any symptoms, but when given in a diabetic person it may cause symptoms and that may even cause death. Sleep and intoxication. The action of a poison is delayed if a person goes to sleep soon after taking it. So when you want to kill somebody, make sure he or she will not sleep after you give the drug. Cumulative action. Poisons which are eliminated slowly may accumulate when given in repeated doses for a long time and may ultimately produce symptoms of poisoning. This is a example for cumulative action. The best example is organophosphorus poison. Or any agricultural poisons. The farmers will not know that the insecticides or pesticides that they daily use will accumulate in the body for a long time and cause symptoms of poisoning. The second topic that we discuss is classification of poison. Based on the site of action and medical legal classification, there are two types of classification, that is based on the site of action and the medical legal classification. Based on site of action, they are divided into local and systemic poisons. Based on medical legal classification, they are divided into suicidal, homicidal, accidental, stupefying, cattle poison or arrow poison, and abortifacient. Coming to local poisons, the examples are corrosive and irritants. Corrosives are again of three types: strong acids, strong alkalis, salts. Strong acids is again of two types: inorganic and organic. Irritant poisons are three types: mechanical, organic, inorganic. Organic is again of two types: plant poisons and animal poisons. Inorganic irritant poisons are of two types: metallic and non-metallic. Systemic. So the systemic poisons are poisons that affect the systems such as neuro, cardiac, respiratory, spinal, and hepatotoxic, that liver affecting poisons. Coming to neurotoxins, somniferous, inebriants, stimulants, deliriants, psychiatric, hallucinogens, inhalants, anesthetics are the neurotoxins, or cerebral, which affect brain. Cardiac poisons, respiratory poisons include asphyxiants, which causes respiratory distress. Hepatotoxic poisons include pesticides, organophosphorus poisoning. Spinal poisons include CNS depressants, CNS deliriants, CNS stimulants, psychotropic drugs. Classification in detail. Strong acids. The examples of inorganic strong acids are hydrochloric acid and nitric acid. For examples of organic Strong organic acids are carbolic acid, acetic acid, oxalic acid, salicylic acid. And strong alkalis are carbonates, hydrates of sodium, potassium, and ammonia. Salts are copper sulfate, zinc chloride, ferric chloride. And examples for irritants are mechanical powdered glass, hairpins, etc. And organic irritants are plant poisons include abrus, calotropis, and animal poisons include snakes and scorpion. And inorganic include mercury, lead, arsenic. These are all metallic inorganic poisons, and non-metallic inorganic poisons include iodine chloride. And neurotoxic cerebral poisons include somniferous narcotics, those induce sleep. Example: opium, morphine, codeine, and heroin. And inebriants, those which produce confusion and disorientation. Example: alcohol, barbiturates, chloral hydrate, and paraldehyde. And stimulants are amphetamines and cocaine, which stimulate CNS. Deliriants are datura and cannabis, which produce confusion. Psychiatric drugs are antipsychotics and antidepressants. Hallucinogens are LSD, lysergic acid diethylamide. Inhalants are glue sniffing and volatile substance abuse. Anesthetics are chloroform, nitrous oxide. Spinal poisons, as we discussed earlier, they are CNS depressants, CNS deliriants, CNS stimulants, and psychotropic drugs. CNS depressants include alcohol, opium, and its derivatives, sedative hypnotics, barbiturates, benzodiazepines, hydrocarbons, general anesthetics, ether, chloroform. Hydrocarbons include chloral hydrate, kerosene, turpentine, naphthalene. And CNS deliriants produces delirium. They are cocaine, caffeine, amphetamine, methamphetamine. CNS stimulants include which increase mental alertness. They include cannabis, datura, atropa belladonna. Psychotropic drugs include antidepressant, tranquilizers, hallucinogens. And cardiac poisons include aconite, tobacco, digitalis, oleander. Respiratory poisons include carbon monoxide, carbon dioxide, water gases, sewer gases. Pesticides are organophosphorus. And miscellaneous poisons include analgesic, antipyretics. Accidental poison. So now the classification, which is based on the site of action, is completed. Now let us discuss the classification which is based on medico-legal reasons. They are accidental. Accidental poisoning occurs where necessary safety measures are not taken. Careless handling and storage of poison, careless spraying in the fields without protection, treatment by quacks, bites by snakes, scorpions, or insects. It is seen in children, drug addicts, farmers, laboratory and factory workers. And stupefying poisons. It is commonly used to facilitate robbery, rape, etc. Example: datura, cocaine. Alcohol, cannabis preparations such as bhang, charas, and ganja. Abortifacients, to induce criminal abortion. Example: calotropis, croton oil, corrosives, ergot, and oleander. Cattle poisons for killing cattle to get cheap leather. Example: Abras, strychnine, and oleander. Arrow poisons applied on the arrowhead to kill animals or enemies. Example: Abras, strychnine, aconite, curare and calotropes, and snake venom. Now, classification of poisons is completed. Now let us discuss about duties of registered medical practitioners in cases of suspected poisoning. Registered medical practitioners are as doctors. It has both medical and legal responsibilities. Medical: we should take history of the patient. We should ask questions such as quantity of the tablets or liquid consumed, time of consumption, what tablets or liquids consumed, which means what type of poison you have taken. These are the questions you have to ask the patient if we suspect that the patient is having taken the poison. Symptomatology: quickly analyze the symptoms and diagnose the poisoning. Treatment: doctor should not allow anyone except hospital nurse to administer medication and nourishment for the safety of the patient. Doctor should maintain written record of his findings and treatment that is useful to the physician in the court. Legal responsibility of the doctor in suspected cases of poisoning. Preliminary data: personal data like age, sex, identification marks of patient should be written, and he or she, the doctor, should inform the police. If he is a private doctor, he should inform only about homicidal poisoning. There is no responsibility for him if the condition is suicidal and only one person came to the hospital. He can maintain professional secrecy of the patient, and if he is a government doctor, police officer of nearest station should be informed about the cases of homicidal, suicide, accident, or any accidental poison. Any kind of poison, if he is a government doctor, he should inform to the police officer of the nearest police station. Whereas private doctor, there is no necessity. He or she should inform only if it is a homicidal poisoning. Collect and preserve the following as evidence: vomiters, stomach wash contents, and samples of urine or feces, or and suspected food or drink, or medicines in separate glass bottles which are labeled with name of patient, material, reserved date and time of examination, kept under his custody until it is handed to police officer for chemical analysis. Death certificate: if the patient dies, he should not issue a death certificate, but he should inform the police and hand over the body to the police officer for further investigation. Public health authorities must be notified in cases of mass food poisoning arising from canteen or mess or hostel, etc. These are the duties of registered medical practitioners in case of suspected poisoning. Contraindications for gastric lavage. Gastric lavage is contraindicated for certain poisons. These are the contraindications of gastric lavage. All corrosives except carbolic acid are contraindicated. That means Except carbolic acid, none of the corrosive poisons, none of them, in those cases, we should not perform gastric lavage. For example, sulfuric acid poisoning, which is a corrosive, and the mnemonic for remembering this is 4 C's. Contraindications for corrosive poison include comatose patients, all corrosives except carbolic acid, convulsions, and children. What is meant by gastric lavage? Gastric lavage is done to remove unabsorbed poison from stomach. These are other contraindications, which are mechanical poisons, esophageal varices, hemorrhagic diathesis. But the main important contraindications can be remembered by 4 C's. Those are all corrosives except carbolic acid, comatose patients, convulsions, and children. Demulsions. Demulsions are substances which form a protective coating on the gastric mucous membrane and thus do not permit the poisons to cause any damage. Example: milk, starch, egg white, mineral oil, milk of magnesia, aluminum hydroxide gel, etc. Fats and oils should not be used for oil soluble poisons such as kerosene, phosphorus, OP compounds, DDT, phenol, aniline, acetone, etc. Bulky food act as mechanical antidote to glass powder by imprisoning its particles within its meshes. Demulsions, the best example is milk. When someone took poison and you want to save them, give milk or egg white. These act as demulsions. These are demulsions which forms a protective coating on the gastric mucous membrane, and this will help to prevent the poison to cause any other damage. Since they will not allow the absorption of the poison into the stomach wall, it will not cause any damage though the poison is taken. And now let us discuss about universal antidote. When you don't know what poison the patient took, you can give universal antidote, which is useful for any cause of any case of poisoning. The composition of universal antidote include 3 ingredients. They are charcoal, magnesium oxide, and tannin. Dosage 30 grams orally, repeated 12 hoursly. Charcoal 50%, burnt red. It absorbs poison. 2 parts. For example, it for 2 parts of charcoal we have to add 1 part of magnesium oxide and 1 part of tannin. If charcoal is 50%, we have to add magnesium oxide 25% and tannin 25%. Magnesium oxide is milk of magnesia which neutralizes acids, and tannin is a strong tea which precipitate metals and glycosides and alkaloids. This is all about universal antidote. Multi-dose activated charcoal. It is a black, fine, odorless, tasteless powder or tablet, which is seen like this. Preparation. It is prepared by heating common charcoal which is formed by wood in the presence of gas. Uses. It is used as antidote in poisoning due to heavy metals. Flatulence. It uses it is used for flatulence, which means accumulation of gas in alimentary canal, and it can also be used as for lowering cholesterol in daily life. Action. The given flowchart explains the action of activated multi-dose activated charcoal or multi-activated charcoal. It facilitates the passage of substances from plasma into the intestinal lumen, where the concentration of toxin decreases by intraluminal charcoal absorption and decreases half-life of several drugs. Initial loading dose is 1 to 2 grams per kg. Repeated doses of 0.5 to 1 gram per kg are given at 4 to 6 hour interval, or it can also be administered by continuous infusion of 0.25 to 0.5 gram per kg per hour through a nasogastric tube. So the summary is the concentration of toxin decreases by intraluminal charcoal absorption, and it decreases the half-life of several drugs. So we gave multi-dose activated charcoal to decrease the half-life of several drugs and to decrease the concentration of poison. How this happened means, because the multi-activated charcoal facilitates the passage of substances from plasma to the intestinal lumen. Activated charcoal with pores on its surface, poisons such as heavy metals, alkaloids, glycosides trapped in the pores of that activated charcoal, and the poison can be excreted unabsorbed. Side effects: constipation, intestinal block, black stools. So why intestinal block happens? As we explained earlier, it facilitates passage of substances from plasma into the intestinal lumen, hence intestinal block happens. Agricultural poisons. There are two agricultural poisons. They are organophosphorus and organochlorines. Organophosphorus poisons. OP poisons. Organophosphorus compounds are derived from phosphoric acid. They are divided into two groups, aryl phosphate and alkyl phosphate. Aryl phosphate poisons are of two types, parathion, diazinon. Alkyl phosphate poisons include malathion, trichlorphan, HETP, TEPP. Absorption through skin, inhalation or ingestion. Fatal dose. Parathion fatal dose is 200 milligrams and malathion is 1 gram oral. Action of OP poisons. Acetylcholine. Inhibition of acetylcholine at myoneural junction and synapses of ganglion. Causes accumulation of acetylcholine, which causes appearance of symptoms. The symptoms are muscarinic symptoms, nicotinic symptoms, and CNS symptoms. Muscarinic symptoms appear due to parasympathetic effects on glands and hollow organs because of accumulation of acetylcholine at myoneural junction, and nicotinic effects appear due to ganglionic and somatic motor effects. And the mnemonic for remembering muscarinic effects are dumb Elsa, Elsa is a Disney princess. Dumb. The abbreviation for dumb is D for diarrhea, U for urination, M for meiosis, and B for bradycardia. Due to bradycardia, hypotension can be seen, increased in tracheobronchial secretion, bronchospasm, bronchoria. We can remember these all things by remembering B of dumb. Elsa means, if we abbreviate Elsa, E means emesis, L means lacrimation, S means sweating and salivation, A means abdominal cramps. For remembering nicotinic symptoms, M and M is mnemonic, M for muscle weakness and another M for muscle twitchings. For remembering CNS effects, high cars is mnemonic, H for headache, I for irritability, C for convulsions and coma, A for ataxia, R for restlessness, and S for slurred speech. In mild poisoning, nicotinic and CNS effects are absent. In severe poisoning, respiratory muscle paralysis and convulsions occur. Management of OP poisoning. For detoxification, if poisoning is through skin, remove clothing and wash the skin with soap and water to prevent further absorption through clothes. Wash the eyes with water and or normal saline and give activated charcoal for 1 gram of the per kg body weight of the person. If consumed by oral route through gastric lavage or stomach wash with 1:5,000 potassium permanganate solution, remove the poisonous effect on the GI tract. And antidote for OP poisoning is atropine. IV 2 mg every 10 minutes till pupil dilates. We should administer atropine. And another drug that is useful in OP poisoning is oximes other than atropine. Oximes like pralidoxime and diacetyl monoxime. They combine with cholinesterase organophosphate complex release binding and set free ACHE enzyme. By seeing the diagram, you can understand the statement. Cholinesterase enzyme, so the OP compound will occupy the space, cholinesterase enzyme, and the pralidoxine make that OP compound busy by binding to it, and it causes reactivation of cholinesterase enzyme and it set free the cholinesterase enzyme. Supportive measures include patient should be in prone position to avoid aspiration of secretions and maintain BP and airway. Preventive measures include protective clothing. Patient should not be suffering from upper respiratory tract diseases. The mode of action of atropine. Atropine blocks the muscarinic receptors, gives only muscarinic symptoms. And the mode of action of oxime is it binds to cholinesterase complex and release cholinesterase. Cholinesterase degrades, ACH reverses all symptoms. So the question is, atropine, it will reverse only muscarinic symptoms, but oximes reverses all the symptoms. But as we discussed here, atropine is drug of choice. Why? Because Atropine can reverse muscarinic symptoms, but the drug effects are for long time. The oxam drug effect only if the patient is brought to hospitals within 5 minutes after the administration of the OP compound. It will not affect after uh, 1 hour or 2 hours. So the patient should be brought to the hospital early if oxams are to be worked. Post-mortem changes that are seen in poisoning include external post-mortem changes include kerosene-like odor, froth at mouth and nose, signs of asphyxia, constricted pupil, meiosis. These are all external changes. Internal changes include GIT is congested, smell of kerosene in contents of stomach, lungs and other organs are congested and edematous. Medical legal importance of OP poisoning are suicidal poisoning is common in farmers. Accidental poisoning is seen in children and workers involved in manufacturing it. Organochlorines. Examples for organochlorines are DDT, gamma benzene hexachloride, endrin and aldrin. Uses organochlorines are used as insecticide, scabicide, pediculocide. Fatal dose of DDT is 15 to 30 mg. Endrin poisoning or organochlorine poisoning. It belongs to cyclodiene insecticide and is a polycyclic polychlorinated hydrocarbon. It is a stereoisomer of dialdrine. It is bitter in taste. Also called plant penicillin because of its broad spectrum of activity against various insect pests. It is sold in the market under the trade names of Endox DB50, Endrin B16 and Tox EC20. These products contain about 20 to 50% of endrin mixed with petroleum hydrocarbons such as aromatics which smell like kerosene. Endrin is rapidly metabolized and eliminated and does not persist in body tissues. Symptoms they begin within 1 to 6 hours. They are salivation, nausea, vomiting, headache, giddiness, dyspnea, restlessness, hyperirritability, abdominal pain, rarely diarrhea, froth at the mouth and nose, dilated pupils, incoordination, ataxia, mental confusion, hoarseness of voice, coughing, tremors, tonic-clonic seizures, and coma. Death due to respiratory failure. In non fatal cases, most people feel well after 24 hours. For remembering the symptoms of organochlorine poisoning, I kept this emoji, but only few symptoms can be remembered by seeing this emoji. That is, those are ataxia, headache, giddiness, dilated pupil, salivation, vomiting, convulsions. Fatal period is 24 hours. The treatment, let us discuss the treatment part. Endin have no specific antidote. If the mental state is altered, we will give dextrose, naloxone, thiamine. For convulsions, we will give diazepam, phenobarbital, calcium gluconate. As we discussed, it causes mental confusion. Calcium gluconate is very useful because it reduces mental confusion. To exchange resin, cholestyramine, it increases fecal excretion of organochlorines. It is given 16 gram per day in divided doses. Post-mortem appearance. The mouth and stomach content smell of kerosene. Signs of asphyxia are present. As we discussed, endrin is mixed with hydrocarbons which smell like kerosene. So the stomach contents of the person also smell like kerosene. The medical legal importance of organochlorine poisoning is the suicide is very common in spite of its unpleasant taste and painful death because of because it is easily available in market. Corrosive poison. Corrosives are also known as caustics. They are of two types, acids and alkalis. If you don't know anything, we can just write if corrosive acids poisoning is because of corrosive acids, we can write it causes corrosion and burns, and if it is because of alkalis, we can write liquefactive necrosis and saponification of fats are seen in alkali poisoning. And the important questions in this chapter are vitriolage and carbolaria. Vitriolage. Sulfuric acid is known as oil of vitriol. Vitriolage. Vitriol throwing is known as vitriolage. Throwing of sulfuric acid on another person's face is known as vitriolage. Parts involved are face and eyes. Victims are usually female. Clinical features: pain due to chemical burns, eyes. The effects on eyes are conjunctivitis, necrotic keratitis, and blindness. Face: chemical burns, later on secondary bacterial infection burns heal slowly with development of scar and strictures causing disfigurement of face. Treatment: wash the affected parts and eyes with water and apply sodium bicarbonate. Analgesics for pain: morphine is usually given as analgesic. Antibiotics for infection to reduce secondary bacterial infections. Plastic surgery for scars and strictures, and prednisolone to decrease inflammation, and laparotomy if stomach also affected and perforation of stomach is seen. IV fluids to correct shock, and tracheostomy for edema of glottis if there is edema of glottis. Punishment: imprisonment for 7 years under section 326 IPC. It is grievous hurt because it causes blindness, disfigurement of face and pain for more than 20 days. Other clinical features include mouth, burning pain from mouth to stomach, intense thirst, vomiting. Vomiting is in coffee brown color, dysphagia, dysphonia, dyspnea, continuous flow of saliva, tongue and lips become swollen and chapped. Marks of tickling of acid on angles of mouth, acidosis. Stomach, perforation of stomach, peritonitis, shock, and this finally lead to renal failure. Stricture forms in esophagus and stomach in long standing cases. Post-mortem changes: skin and mucous membrane appear brown due to corrosion. Teeth become chalky white. GAT shows corrosions, necrosis, perforation. Stomach may be converted into a soft black mass. Respiratory tract, corrosion of larynx and trachea may be present. Carbolaria or carbolism. Chronic poisoning of carbolic acid is known as carbolaria or carbolism. Uses: carbolic acid is used as disinfectant or preservative. It is seen in medical professionals and those who are handling it. As it is a disinfectant, we daily use disinfectant in hospitals. It is seen in medical personnel and those who are handling it. It is characterized by anorexia, weight loss, headache, giddiness, dark colored urine, and pigmentation of skin, sclera, other cartilages, oochronosis. Pigmentation is due to hydroquinone and pyrocatechol, the two metabolic derivatives of phenol. Treatment: wash the skin with water. Stomach wash with sodium sulfate, activated charcoal, methylene blue for methemoglobin, dialysis for renal failure, saline containing 7 grams of sodium bicarbonate is given to dilute carbolic acid to improve blood pressure and excretion of carbolic acid. Post-mortem changes that are seen include smell of phenol of the dead body, corroded skin and mucosa with white eschar, kidneys are hemorrhagic, laryngeal and pulmonary edema. The symptoms can be removed by this picture. The picture shows that a girl is suffering from carbolic acid poisoning. She have headache, giddiness, pigmentation of sclera, pigmentation of skin, dark colored urine and weight loss. Thank you.